let's talk about harmful habits that have an effect on the growth and development of the dental facial complex. And the first thing I want to say is the first harmful habit uh, is the parents' health habits uh, at conception. If the parent is either parent is unhealthy or has unhealthy habits prior to conception, that's going to carry over. So to get the ball rolling right, both parents really need to be in a healthy state before they have children. That would solve a lot of problems right there. All right. So then conception, the 9 months are important, that the prenatal care is good, the nutrition is good, the mother doesn't have any unusual stresses in her life. There's not a divorce, or there's not deaths in the family, and there's not any kind of traumatic accident. So that 9 months is precious time, and that has to be healthy as well. So now we have birth. And so at that point, one of the biggest problems at birth is a child can't nurse properly. Well, we have specialists in that. So nursing is an important development of a child, very important. And the length of time is important. That doesn't get the attention that it deserves. But when the nursing has been solved right, and the latching is good, all right, so that's a great solution. The next thing that affects children is just the environmental thing, the allergies, the inflammation that they would have with the tonsils and adenoids. Now, I tell people all the time, the good Lord didn't give us tonsils and adenoids so the surgeon could remove them at age 3 or 5. I mean, that doesn't make any sense. So what's happening? Why do we have so many tonsils and adenoids have to be removed when they're a vital anti-inflammatory and anti-allergic defense mechanism? Well, the problem is this. We go back to the allergies. We have the children that are mouth breathing. When you're mouth breathing, you're just breathing dirty air. The tonsils are right at the base of the tongue. The adenoids are right above that. So you have unfiltered, dirty air infecting the tonsils and adenoids. Whereas if you're nasal breathing, mouth breathing is really a problem from early on till adults. So the filtered air, the highly filtered air that is sanitized through the nose, that's a must. So how do we deal with it? People laugh about it. We correct mouth breathing by taping. It's a very important part of learning to use the nose properly. If you can't breathe through your nose, that's not an orthodontic problem. That has to be resolved with an ENT specialist. What's kind of distressing is we're seeing a rise, and we've talked about that, the vaping as a substitute for smoking. Well, it's a very poor substitute for smoking. I mean, both are bad, and we really don't even know the ill effects of vaping, but it's easy to correlate that it's going to be a bad news result, that's for sure. So, but another thing that's really outside the oral environment that's bad with kids is the cell phone addiction. They're not sleeping properly. They're texting each other at all hours of the night. You got the blue light from the screen. You're getting kids really addicted to their cell phones. It's amazing. You go anywhere and everybody's, looking down at their cell phone, walking into posts and bumping into people and driving in the car. This is a scourge, man. I'm telling you, and it's alarming what's happening to people just with that cell phone undisciplined. So those are the things that are really outside the oral environment that are really unhealthy habits. Let's go inside the mouth and take a look at that. We talked about the one unable to nurse properly. All right, that's got to be taken care of. The next thing is that we see is overuse of pacifiers, and then later on sippy cups. There are a few pacifiers that are naturally designed to more imitate natural nursing. However, on the other hand, they're lousy baby bottle nipples and pacifiers that really are a detriment to their development. They're not getting the muscle development properly from those devices. So you need to be careful. I'm not condemning all of them, but certainly bottle feeding, improper bottle feeding, or improper pacifiers that are just all the time, to hush the baby up. That's kind of the new method now of silencing a crying child. So yeah. Sometimes crying is good for the lungs. I mean, there's something natural about the baby needing to cry to develop the lung capacity. It's not all bad. It's just irritating. I never thought about that before. No, it's a powerful way to develop their chest and their strength. So you don't want you don't want to have that's totally a silent child. Another habit we see that we've talked about a little bit is you have to. The tongue is the tongue is a real issue with the development of the teeth, face, and jaw structure if it's non-functioning right. If its posture is not right, if you're pronouncing your words wrong. An undisciplined tongue, particularly on swallowing. So it opens the bite up. So tongue training, tongue posture, tongue function, super important as a child grows. Another thing that's not really considered, it's not an oral habit that's bad, but it's a sign that something is bedwetting. Bedwetting of a child that's really over 5, 7, 8, bedwetting. That's a sign that they're not sleeping well, and that needs attention too. So that's something maybe a lot of parents don't realize, that late age bedwetting is certainly an issue with sleep. And the last oral habit that we really see is decidedly harmful in many ways, and we'll enumerate is clenching and grinding. It's amazing how many people are abusing their teeth with that habit, and they don't even know they're doing it. That happens at night. That's another sleep disruption. But not only is it harmful to the delicate temporomandibular joints, putting that kind of force on them at night when they should be resting. The damage to the teeth is significant. I mean, people just can wear their teeth down to over half their length and into the dentin, and that is a very expensive repair to rebuild teeth from aggressive wear.
What causes the grinding?
What causes the grinding? That's a great question, because anxiety, worry, fear, these are things that are really an epidemic, it looks like. We've had the COVID, the hurricanes, you got the election, you got people just, where is this world going to? And we see so many people that the anxiety it carries over in the dental. It's the reason why they're ruining their teeth, cracking their teeth, have the TMJ problem, not sleeping well. So, of course, I'm an orthodontist. I'm not a psychiatrist or psychologist to deal with that, but that is a huge question, and even with the kids. So, of the two things that are really attacking us is inflammation. That's huge. And this anxiety, fear, and worry, those two things are really destroying the health of not just Americans, kind of the world over. We got to settle down and have a little bit better outlook on life. Really got to calm down and enjoy life and see life as good and wholesome and with a lot of benefits and delightful and a real opportunity to thrive, and instead of living in fear of the sky falling on us.
I mean, that's pretty much what every news outlet.
Quit watching the news, man. Oh, I'm not kidding you. We've lost our television and the internet for over a month, and it's the greatest thing in the world. And now I don't even want to watch TV anymore. We just got out of the habit. It's just so rich, The wife and I are spending better time together, and I'm not sitting in front of. So anyway, for me, it's been wonderful to take a real huge vacation and from television and all the other distractions.
Definitely.
We'll all be healthier.
I have one more question going back to the sleep, not having good sleep. So is a part of the issues that come from not having good sleep?
Oh my goodness, yeah. Oh my goodness. Sleep deprivation is a horrendous torture
in
to the body.
Adolescence, though, does that not allow teeth development to occur as like smoothly, or
sleep disruption or sleep deprivation is so harmful to the immune system, and it's so harmful for the recovery of the body every day. I mean, every day your batteries, in a sense, have to get recharged, and the body has to be cleansed of all the garbage. Is a new in word now, everything, but the garbage has got to be carried out of the body too. So sleep health and nutrition are the two pillars of health, no question about it.